That's the toughest job probably any representative will face, is pronouncing my horrible last name. You know, AARP is an organization that represents people who are older than 50. But as Representative Oaks has pointed out, if you're 65, you qualify for Medicare. So what I'd like to do this morning is to focus on our members, on the people over 50 but not yet eligible for Medicare, and tell them through you what type of benefits that the HIP Michigan plan will produce for them. Now, one of the benefits of the HIP Michigan plan is that residents age 50 and older with pre-existing health conditions who retired early or who lost health care coverage when they lost their jobs, as many have, are now able to get coverage. While HIP Michigan cannot cover every Michigan citizen, it will provide an important option for many who have been blocked from coverage by private insurers. And they've been blocked because their medical history doesn't meet the qualifications of many private plans. HIP Michigan provides a stopgap for many who have the hardest time buying affordable coverage. Until now, while waiting to join Medicare, many early retirees have found they cannot afford the high costs of individual policies, especially if they have pre-existing health conditions. Sickle cell anemia, asthma conditions, Alzheimer's, Parkinson's, and AIDS. As serious as that. So if you have been denied coverage because of a pre-existing medical problem and have been without insurance for at least 6 months, you may be able to get coverage through HIP Michigan. The HIP pre-existing insurance plan, though, will run only till January 1, 2014. And at that time, anybody without health insurance will be able to buy coverage through state insurance exchanges. At that time, insurance companies will be prohibited from denying people coverage because of their health or past medical history. But until then, we depend in part on HIP Michigan. Now let's talk about an example, a concrete example of a person who could benefit. You might have a man in Saginaw who is permanently disabled, in his 50s, and his Social Security disability payments push him over the eligibility line for Medicaid, which is really a very low income indeed. Now, even if this person cannot afford to buy health insurance, and federal rules still say he must wait 2 years for Medicare, then his condition may have deteriorated, as Senator Kahn said, to the point where it's too late for surgery. So we really can't afford to wait. We need something to insure these people now. So is there help for somebody like that? Yes. Thanks to the creation of HIP Michigan, the answer is that a plan is available to get these people the care they need and to make sure their conditions don't deteriorate further. For people who have had no insurance for 6 months and have at least one medical condition or disability that has made it impossible for them to buy coverage, HIP Michigan is a plan worth considering. It's important to understand that insurance purchased through this program may not necessarily be inexpensive, but it is available, which is often not the case. You can't be turned down for the HIP coverage because of a health issue or disability that you already have. And older members cannot be charged more than 4 times what the younger members pay for coverage. HIP Michigan is a step in the right direction for Michigan's elderly citizens. So on behalf of AARP Michigan, I would like to thank all of you, the media and others, for helping us to publicize the HIP option. And now I'd like to invite John Graham, President and CEO of St. Mary's of Michigan, back to the stand.